I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases.
The WHO says the number of new COVID cases worldwide jumped by 11% last week compared to the week before, and the increase is leading to a spike in hospitalizations and deaths. With the third year of the global pandemic at our doorstep, new infections driven by Omicron are skyrocketing at an unprecedented pace. France setting a European record with more than 200,000 new cases Wednesday.
Ce sont des chiffres qui donnent le vertige.
The numbers are dizzying, says the French health minister. He estimates 2 people are testing positive every second in his country. Italy, Spain, Greece, just to name a few, also hitting all-time highs this week. Same story in the UK, where hospitalizations are rising.
The overwhelming majority of people who are currently ending up in intensive care in our hospitals are people who are not boosted.
Experts warn it could still be days until we see the true impact of the holiday season, as many countries are grappling with testing shortages and delays for results. Further chaos as the virus is leading to staffing shortfalls.
We know now incontrovertibly that this is a highly transmissible virus.
That from the top U.S. infectious diseases expert, who adds early indications are building that Omicron may cause a milder disease than Delta. The U.S. is seeing more cases than ever before. The 7-day average of infections now around 270,000, more than doubling over the past 2 weeks. While hospitalizations and deaths are rising, both are well below their peak. But those tallies often lag behind cases.
We generally know that most of your transmission potential happens in those 1 to 2 days before you have symptoms and those 2 to 3 days after. Facing pushback, the U.S. CDC defending its new guidelines, shortening the recommended isolation time for Americans with asymptomatic cases of COVID-19 to 5 days from the previous guidance of 10 days. This was really a way to tell people, make sure you isolate in those first 5 days when you're maximally infectious, and then of course wear a mask for those last 5 days to make sure that you don't spread anything that might be left over to others. Also out of the U.S., the CDC now investigating 86 cruise ships with reported COVID outbreaks. Melissa Duggan, City News.